Bonding agents are resin materials that bind dental composite fillings to enamel and dentine tissues. Bonding agents combine mechanical interlocking and chemical bonding for adhesion. Chemically, on one end, bonding agent molecules have a surface active group such as a phosphate, which adheres to enamel and dentine. On the other, a methacrylate group bonds the composite polymer matrix. There can also be some chelation of functional groups with tooth calcium ions. Primer is a hydrophilic monomer that is applied before or with the bond and influences bond strength. It can penetrate into the gaps between tooth collagen fibrils, particularly in dentine, adhering to them and thereby preparing the surface for the bonding resin. There is also micromechanical interlocking, which is created by acid etching. Long-term success of a restoration can be improved beyond mechanical retention through the use of bonding. Bonding is manifest with the use of phosphoric acid, which in dentine removes the smear layer and opens up dentine tubules, while on enamel it creates porosities, both of which produce a large surface area for bonding, and a greater bond strength is therefore achievable. For example, the 5th-gen bonding system is applied in clinic as follows. The dentist must etch, rinse and dry, apply a thin layer of primer bonding resin mix, and then finally cure with UV light. Dental bonding has been in development since 1965, and dentists are currently using 4th, 5th, 6th, and 7th generation systems. 4th gen systems were the first to completely remove the smear layer. The etchant, primer, and bonding resin in this generation are housed separately and applied sequentially, which is very technique sensitive but effective when used correctly and the most versatile. With the 5th gen system, the etchant is in one container while the primer and bonding resin is in another. It has the same mechanical interlocking as its predecessor, while also having high bond strength values to dentine with marginal seal and enamel, and thus overall has long-term higher clinical bond strength. It is, however, more susceptible to water degradation. In 6th gen systems, self-etching primers were developed, where the etchant and primer are combined with the bonding resin in a separate container, which is advantageous as it appears less dependent on the hydration state of dentine than the other generations. Bonding to enamel, unfortunately, is less effective due to insufficient acid pH to properly etch enamel. One can, however, selectively etch enamel after dentine etching is finished to overcome this. The simplified 7th gen system houses all components within one bottle. Due to the inherent instability of such a liquid, the acid strength had to be reduced, which resulted in a decreased bond strength relative to other generations. The acid also reacts negatively with composite resins, further affecting bonding integrity. Their hydrophilic nature is another characteristic that results in earlier bond degradation.